In today's Medical Minute, people experiencing a mental health crisis will no longer have to dial a 10-digit phone number or get 911 to get help.
Beginning tomorrow, there's a new 3-digit hotline people can use here in Oklahoma and across the country. Shannon Maudie explains how 988 works.
There's been a lot of aspects of it that were out of our control. And so preparing the best we can in terms of anticipating volume, staffing, technology changes.
Changes mandated by Congress to modernize a suicide prevention lifeline that's been taking calls for over half a century. Same lifeline, new number. 988 takes effect Saturday, and Drew Martell is ready for the switch.
What we think is over the next year or two, we'll continuously see a buildup of volume.
Martell says staff are ready too. Although Foundation 2 will be hiring for some time, it's a tough role to fill.
Absolutely it is. We are in a time that's unprecedented in terms of finding staff, and this is a unique field to be in.
Sometimes calls are back to back and can be a little overwhelming. Other times, it might be a little bit slower.
Meadow is one of those on the other end of the line as calls have picked up a record pace.
So last month we took 6,314 calls. Contacts, so that's calls, chats, and text messages.
More than 41,000 contacts already this year. While Martell says the center's ready, there are still unknowns. The biggest is state funding.
I don't know what the solution is going to be long-term to fund the lifeline. This is one of the big changes going into 988 is that funding is shifting to states, whereas it previously there really wasn't funding.
Now crisis centers will be federally reimbursed to staff the line and ready to answer the call.
If someone is out there and they're struggling or they know someone that's struggling, we want them to reach out now and get that support.